Welcome to the AHEPP podcast. I am Keith Hansen. I'm the co-director of the Association of Healthcare Emergency Preparedness Professionals. My co-director, Christy Sanger, is not available today, so I'm going to be leading this podcast. And in the booth with me today is Anna Hansen, the producer, who is our tech guru and podcast genius. So, our first podcast from AHEPP is actually an interview with Rachel Lakadoo. Rachel is an attorney that specializes in a number of things, including public health law, and she's working a lot right now on quarantine and isolation issues, but she also has a broad experience in history in Centers for Medicare, Medicaid Services guidelines and regs, and that's what I'm talking with Rachel about today. I hope you enjoyed the podcast. It will be about 30 minutes, and we will talk to you again in about 30. Please enjoy. So did you know that there were 200,000 fatalities from the Indonesian tsunami?
I did not know that.
200,000 people.
That's a lot of people.
That's a lot of people. I don't think CMS would have helped.
No, that's probably a good point. That probably was not.
No.
Yeah.
Probably not a benefit.
There was probably other issues beyond Medicare there.
I don't think so.
Yeah.
So, welcome to the AHEPP broadcast. We are podcasting, not live, but podcasting from a small booth in Omaha, Nebraska. And this is our first podcast, so I'm pretty excited about this. And I'm especially excited about our guest, whose name is Rachel Lakadoo. And I'm going to let Rachel introduce herself. But this is someone that's fun to talk to, and smart, and knows what she's talking about. And I'm excited because this is going to be a comfortable conversation. I don't feel like this is going to be what will we talk about for 30 minutes? We spent like 8 quality hours on the road.
We did.
Yeah.
We did.
And
now we're fresh out of topics. Now we've exhausted everything to talk about.
Yep, that's pretty much where it goes.
Yeah.
So, Rachel, tell the audience about yourself.
Sure. So I'm Rachel Lakadoo, and I work at UNMC, University of Nebraska Medical Center, in the Center for Preparedness Education with Keith. Mm-hmm. I act as the Director of Legal and Public Health Preparedness, and the legal is in there because I am an attorney. That's my background. And prior to coming to UNMC, I was actually with a long-term care and PACE provider helping them implement the CMS regs, which is kind of what got us here today on this webinar.
Mm-hmm. Absolutely, yeah. So it's tell them a little bit more about, so one of the things I found interesting about you is I had no idea about your compliance background and all that. I mean, your CV is kind of impressive when it comes to that stuff.
I'm glad you think so.
I do.
I'm glad you do.
And I'm not just saying that because we're on tape.
Okay. That's fair.
And that doesn't date me at all. You use the word tape.
Right. On the cassette. So my background before I was doing Medicare compliance is I was doing a little bit different regulatory compliance working in banking, which was totally different world. And I realized I don't enjoy working with numbers or finance. I like people more. So I jumped over to the medical side. But prior to doing compliance work throughout law school, my focus was on healthcare and health policy. And so I did quite a bit of work with Medicare, Department of Labor, American Bar Association, just kind of all over the place doing health policy work.
So what is it about CMS, the rules and regs that kind of appeals to you?
Well, who doesn't get excited
that's true.
about Medicare?
You're
I think
right.
that's
that
universally exciting.
That was a really silly question.
No, so I think it's the preparedness part more than anything else that got me into it. So I like to joke that as a lifelong worrier, this was just kind of an inevitability for me. I've always been preparing for the worst, so why not get paid for it, is my philosophy. So once CMS came out with the emergency preparedness regs, I just got really into it and really enjoyed working on it and thought it was actually fun, which is weird, and who gets excited about that? But I do.
You need to exist because there are people like me that exist that saw the 600-page document and went on to their next task.
Right, and I was like, print that out, give me a highlighter. Let's do this.
Right. 18 categories? 18 different organizations that are affected by this?
I think it's 17 provider types.
Wow. That's a lot.
That is. It's pretty much everybody. There's a few exceptions, but pretty much anybody who gets any Medicare or Medicaid funding is affected by the regs.
And seriously affected. I mean, there's some
Pretty profoundly.
significant requirements within this thing.
There's a lot of requirements, I think, because it affects people's payment and how they're being funded by the government. And so I think that's inspired a lot of fear and concern about not getting it right because they're worried they're not going to get paid, they're going to get cited. Long-term care providers, they actually go on this national website, Nursing Home Compare, and all of their survey results are put up on there. So if they get cited for these emergency preparedness regs, that's going to show up on a national public website. And I think that just creates a lot of fear about making sure they're in compliance.
Of course it does. Yeah, absolutely. So when you did a webinar for AHEPP, and it was a really well-attended webinar. I think this is a hot topic within this world.
Yep.
People are really concerned about it. And like you say, it affects everybody that's in healthcare related anything.
Right.
So what was give me the kind of 30,000 foot view of the webinar that you talked about?
So the main thing was CMS updated Appendix Z this year. And so Appendix Z is the interpretive guidance for the regs, which basically is where they go in and they put the regulations in kind of more common sense language. Things are kind of broken down, there's more instruction given, and it's really helpful for healthcare facilities and the surveyors to have a better idea of what the regs mean. So CMS this year updated that with some new requirements, and there was a lot of misinformation going around about what those requirements included. So the webinar was kind of to clarify those things and those issues.
Okay, so help people kind of sort the wheat from the chaff, kind of.
Right.
Sorry, that's a very Midwestern
No, that's good.
phrase. I like that too.
That was good, yeah.
Yeah, I don't know what chaff is, but it's...
It doesn't seem good.
No, it
We
can't
just
be.
want wheat.
That's right. That's exactly right.
Mm-hmm.
So what are some of the kind of highlights of that? So if people had to walk away from listening to this outstanding podcast with one message about CMS and these regs, what are the things that, don't worry about that or do worry about that? What's kind of your one takeaway?
I think primary takeaway would be these regs aren't out to hurt you. They can seem scary and a little bit imposing and difficult, but just to keep in mind, they're really about giving your patients or residents the best possible care and ensuring that they're provided for, but also for your business. I mean, it's covering continuity of operations. For me as a lawyer, I tend to think about risk management. So from a litigation standpoint, if you follow the regs and you have good plans in place, you're really well protected in case anything happens. We've seen over and over again in recent years with the recent hurricane seasons, some facilities just didn't have good plans and things went really poorly and they either got sued or they even had criminal charges. And that's terrible. Nobody wants that for their business, obviously. But putting these regs into place actually really protects you from those things.
Well, and I think about some of these care providers and long-term care and assisted living and, some transitional living folks, all of which take CMS funding. And then I think about, okay, my mom's not going to be in one of those.
Right.
And this is what I want in place.
Right.
Yeah.
And I will say for me being in this field, my grandma is in a nursing home in Texas, and now every time I go down there, I'm like scoping it out, wanting to know what their evacuation routes are. So once you start looking for it, you'll see it everywhere.
Oh, I'm sure. And I look at the list of some of those places and the challenges that they've got. Home health, for example. There's some totally different challenges for a non-residential than there are for residential. Dialysis centers, those types of organizations.
Right.
And as I understand it, a lot of those kind of companies are actually doing a lot more. It's not just disaster response or preparedness and business continuity for that site. It's corporate, so they'll come in and they'll take their patients to another site of theirs.
Yep.
Yeah.
Yep. And I think that's, one of the really hard parts about the CMS regs is there are some entities that are more corporate bodies and they have those resources. They can take somebody to another one of their own facilities. They don't need to worry about getting an MOU in place with another business. They can handle a lot of it in-house. In fact, a lot of them have in-house compliance or legal who can help steer what they do. And then we have more rural facilities, and they just don't have those resources. They don't have those options. And so I think it's important to recognize with these regs, people are fighting with very different resources.
Mm-hmm. And I think, didn't CMS just come out, they just sent out a survey, I believe, too, or I'm sorry, they didn't send out a survey, they actually just published some responses from their surveys, some of the data that they found when they went into these facilities and some of the problems, the big picture problems that they were discovering.
Right.
Yeah. It seemed to me to be the usual suspects. It's the exercises,
Yep.
It's the written plan,
Right.
It's the normal stuff that, we were talking to large hospitals about 15 years ago, and now we're talking to everybody about it.
Well, and I think that's something that's actually really been encouraging to see as this rule has been implemented is for a lot of these facilities, hospitals aside, I think they've been doing a lot of this for Joint Commission, but some of the other provider types, this was a whole new world. They didn't really focus on emergency preparedness. They weren't familiar with tabletop exercises or healthcare coalitions. It's been whole new ground. And so I think it's just been really encouraging to see how those facilities have stepped up to the plate and taken on something so new and have done a really good job, I think. There's room to grow, but I think it's been great to see that progress.
Back to your earlier comment about being a professional warrior, I think that's what we do in this world, there's always room to grow.
Right.
I mean, I think we're some of the most hypercritical people on the planet because we look at everything and say, okay, how can that be better?
Yeah, absolutely. And I think that's what a lot of these facilities are doing. And I think that's part of why it is so scary and overwhelming sometimes because, we tend to be a little bit more critical. And so it can be hard to try and implement all of those changes and plans and regs at one time. But I think people are doing a really good job of it so far. So
I know this rule it's almost 2 years old now, I think, right? November?
Almost 3 years old.
Is it almost 3? Oh my gosh, good thing everybody ages but me. So it's almost 3 years old now. I know there's been a lot of surveys done in all 50 states, of course, and those are done generally by the state agency of some kind. I wonder, what's next, I guess, if we had to look into the crystal ball at this whole world of preparedness in healthcare specifically. We got Joint Commission, we have DMV, Det Norsk Veritas, we've got now CMS regs that apply to everybody. Mm-hmm. Are we now in a maintenance stage? Are we now, where do you think we are?
This is entirely speculative.
Absolutely. The world according to Rachel.
Right, which is terrifying. I think the next big thing, one of the big holes I think that was overlooked by CMS was the failure to include assisted living in the regulations. So currently assisted living facilities aren't required to follow any of those regs. However, those are facilities where people are living day to day and are getting, some level of medical care, even if it's very minimal. So I think that's something that will probably change in the coming years. In terms of whether at this point we're just in a maintenance phase, I don't know if we're quite there yet. Some of the things I've seen, there's still so many questions. People are still confused on a lot of different things, so I don't think we're quite at a maintain status quo point yet.
So what are those confusion points?
There's a few.
There are a couple.
There are quite a few.
Right, a lot? Okay.
I
600-page document? Really?
Yeah, I know. It's shocking.
Yeah.
It's shocking and totally understandable. I think one of the biggest ones is the 1135 waivers. I know that came up in a lot of people's surveys, but I think that's an area of a lot of confusion. I've heard quite a few people say to follow the regs, they need to have an 1135 waiver on file. But that is just not possible. That's not how those waivers work. You get them when an event occurs, when declarations have happened. So it's not something you can have on file already. It's just something you have to plan for. But there is a lot of confusion about that. I think we talked about with Christy when I did the previous webinar how we could probably do a whole webinar just on 1135 waivers because I think that's been a huge source of confusion. The other one that I've seen a lot is there's so much confusion about how much food and water and resources you need to have on hand for an event when it occurs. So I think I've heard people say you need to have 72 hours worth of food and water, 48 hours, there's all different numbers, and I kept hearing things and felt like I was going crazy because I hadn't actually seen those numbers anywhere in the regs. And in fact, Appendix Z, the interpretive guidance, specifically states there is no requirement for how much food or water you need to have on hand. It's entirely at the facility's discretion based on their hazard vulnerability assessment and their planning. But there's just a lot of misinformation going around, and I think things like that, those little issues are causing confusion and taking up people's time trying to figure them out.
Sure. Well, and with, 70,000 facilities affected by these regs? That's a lot of time.
Right.
Everybody trying to figure out the same stuff at the same time. That's a lot of waste.
And on top of that, some of the changes this year was CMS added some language in Appendix Z saying that for doing an all hazards approach, which is CMS's big focus, that facilities needed to include emerging infectious diseases at this point. And so I think some people took that to mean, I need to have a plan for Ebola in place. And that's not what it's saying. It's simply saying that when you do your assessment, when you do your planning, keep in mind infectious diseases, but there are no requirements in place for, you to have an Ebola plan or a smallpox plan or whatever the case may be.
Okay.
It's a little more general than that, but that's been another one of those things that I think has taken up people's time in trying to figure out.
Sure. And I know you can educate. Well, I used to say about my kids, you buy them books, and all they do is eat the covers. So I think you can educate all you want. And actually, I like the Ask for Tracy site.
Right.
That you have a lot of concrete information on there about the 1135 waiver is another great example. They have some really concrete stuff on what it is, and how to use it, when to use it, all that kind of stuff. So I really like the Ask for Tracy site as a resource, but aside from that, I haven't seen, other than AHEPP, of course, wink, wink, nudge, nudge.
Well done.
Yeah, nod to ourselves.
Well done.
Thank you very much. I don't see a whole lot of good information out there.
Yeah, I would agree, and I will tread lightly, but I would say for anyone who wants more information on the CMS regs, try to stick to as an official of a resource as you can. I think there's a lot of kind of cottage industries that have built up since these regs came out of people trying to be paid consultants on what the rule looks like. And I just would urge caution as facilities try to use some of those resources. Cece Blondio, who I think is a friend of AHEPP, who works for CMS, she's done quite a few presentations on the regs that are actually really clear, easy to understand. She reviews all the changes. And I would say those kind of things, something that's straight from the source, straight from CMS, Ask for Tracy, those are your best bet for getting good information.
I agree. Cece does a really nice job of taking some of that, a lot of information, a lot of complicated information, and trying to boil that down into the 50-minute section, whatever conference gives her.
Right.
She does. I think she does a really nice job, and we're tickled to have her at our staff all the time. In terms of the rule and interpretation, you'd actually mentioned cottage industry, which is an excellent point. I really hadn't thought of that very much. There's, how do I say this? I'm not generally delicate, and so I won't be now. One of the things we discovered early on was that people at the state level who were doing assessments of facilities were probably as little informed as the facilities themselves. That, I think, is a big challenge. So do you know of any good strategies that are in place? Are there any strategies that should be in place? I think that's an issue, and I'm sure that's getting better. I hope that's getting better, but I think that's kind of a big gap that we have right now.
I agree, and I'm with you 100% in that I hope that is getting better. I don't know if it is. I think that's one of the biggest problems with these regulations is that every state surveys them differently. They have a different body surveying them. They've got different individuals going in, and I think that's part of where some of the misinformation may come from, because some states may more readily provide tags on certain things than other ones, and so it's hard to get consistent national data. So I think that's an area where there needs to be some improvement, a little more standardization. You know, those surveyors use Appendix Z for guidance, and then there's also CMS has an online surveyor training that they provide. But you or I could access that training. It's very general. It takes, I think, I don't know, maybe not even an hour to complete. So it's not a ton of information. So those surveyors, I'm not sure, are really getting enough training as they go in. So I think that's an area that we need some improvement on.
And this is preparedness and exercises and training and communication and all of those things around disasters. That's a career. They already have a career.
Right.
And
right.
now we're asking them to know about stuff that we've spent a lot of years trying to figure out.
Right.
So I don't envy their position at all, but at the same time, it's I think it still is an issue.
Well, and if you think about it, quite frequently, those surveyors, they're not just surveying for emergency preparedness, they're looking at so many different things. This is not necessarily their highest priority. And for some facilities, that may work to their advantage because their surveyor may just not ask a lot of questions about it. But, you know, that's a little tricky.
Yeah.
They're focusing on a lot of different things.
Yeah, and I think we're a very qualitative world. You know, what's a good plan? Is that, you know, how, that's chapter 4 has to have 7 widgets in it, and that makes it good, but we don't have that.
Right.
So that doesn't exist. So, you know, even those of us that are in the field will differ in opinion, argue, is that a better word?
Sure.
Disagree? Okay.
Sure.
Fight?
Yeah.
Okay. Battle?
Brutal battle. Yeah.
Brutal battle, yeah.
Yep.
About what's good.
Yeah.
And what's appropriate, and how should you set up that point of dispensing, and should long-term care really accept people from hospitals or not?
Right.
And I mean, I think those are also valid debates as far as I'm concerned, but the field doesn't even have answers for some of this stuff, so I don't know how somebody walking in cold on their, you know, on their survey is going to have any informed opinion.
Right, I agree.
Yeah.
I agree.
So, I don't want to take too much of your time, because I think we've talked longer than I think we've talked. I think we've talked longer than I think we've talked. This is the quality of podcasting that you can expect from AHEPP. Yeah. Mm-hmm. We're good.
This is good.
Yeah, we know exactly what we're doing. But we wanted to kind of shoot for about a half an hour, and I think that's about what we've been doing, right? So I want to thank you very much.
Of course.
And we will absolutely have you back. I think Rachel plans to be at the AHEPP conference in November. And this is 2019, by the way, in case people are listening to this way in the future.
I hope so.
This is a historical document.
This is timeless.
Yes.
This is timeless.
And now you know why I wanted to do this first one with Rachel. All right. Thanks for being here. I appreciate it.
And if anybody has questions, I would say, you know, Keith and Christy and the crew at AHEPP all have my contact information. I'm always happy to answer any questions about CMS or, well, I'm not going to say anything. That's too broad. I'm not opening myself up to that.
Yeah.
CMS, though,
Yeah.
I'm in.
Sea lions. I want to know what you think about sea lions.
Oof, they're great. They're great.
Yeah.
Keep doing your thing, sea lions.
What else could you think? Yeah.
That's right.
All right.
And that concludes the first AHEPP podcast. Rachel, thank you again for being here and sharing your expertise with the AHEPP members. And thank you to all of you who are listening today as well. If there is a topic you think would be great for an AHEPP podcast, please feel free to send your suggestion to ahep@ahep.org. If you have any questions for Rachel, please also send them to ahep@ahep.org, and we will pass them on to her. Thank you for helping us move preparedness forward.